Welcome to the Explainer. Today, we're taking a patient guide from ART Fertility Clinics UAE and turning it into a clear, comforting roadmap for your fertility journey. If you've been navigating the world of fertility treatments, you already know just how overwhelming all that medical information can be. So we're going to break down one of the most fundamental procedures step by step to give you absolute clarity and a real sense of peace of mind.
Here is our roadmap for today. We'll be covering what this process actually is, why your doctor might recommend it, the step-by-step timeline, what to expect physically, how it improves your chances, and finally, the care at ART Fertility.
All right, Section 1. What is ovarian stimulation? Let's break down some of this terminology.
You know, medical jargon can make fertility treatments sound incredibly intimidating. You might see this complex-sounding term often abbreviated as COH in your paperwork or hear your doctor say it during a consultation and think, wait, what does that actually mean for my body? I mean, the word hyperstimulation sounds pretty intense, right? But the reality is very grounded and super highly regulated.
Simply put, COH just means we're gently encouraging your ovaries to safely produce multiple mature eggs instead of just one. In a standard menstrual cycle, your body usually develops a single egg, but by using specific fertility medications, doctors can stimulate your ovaries to develop several follicles at once. And more follicles mean more functional eggs. This gives you a much stronger starting point for whatever fertility treatment comes next.
Moving right along to Section 2, why is it needed? Let's figure out if this treatment is for you.
There are basically three core situations for COH. Whether you're planning an IUI or IVF cycle, trying to stimulate a normal cycle because of ovulation problems, or just freezing your eggs for future use, this single treatment covers all those bases. If you're doing IVF or IUI, having multiple eggs is absolutely essential to finding the healthiest ones. Or, if your cycles are irregular, this process helps create a predictable rhythm. And hey, if you're just not ready for a family right now but want to preserve your fertility, it's the exact same process used to retrieve and safely store eggs for your future.
Okay, Section 3. How the process works. Let's map out your treatment timeline.
If you're gearing up for this, you are probably craving some certainty about your schedule. Well, what's really surprising about this process is how incredibly fast it is. Medications usually kick off on day 2 or 3 of your cycle, and the entire monitoring and stimulation phase typically only lasts 8 to 14 days, literally just about a 2-week window. The exact duration will just depend on how your individual body responds to the medications, but generally, you're looking at a very focused, short time frame.
During that brief window, your care is heavily monitored. First, you'll have a baseline ultrasound and blood tests. Second, you begin the hormone injections. And third, you'll have regular scans to monitor follicle growth. This close supervision is absolutely crucial. It lets your doctor seamlessly predict the timing of your hormonal changes, which is something that's practically impossible to do naturally, and it allows them to properly judge the quality of the developing eggs.
Which brings us to Section 4. What to expect physically. Let's address those physical anxieties.
This is the big one. The great unknown for so many first-time patients is what this actually feels like in the body. It is completely natural to feel anxious about the physical toll. So, let's just tackle the primary concern head-on. Is ovarian stimulation painful? With all the talk about injections and growing multiple eggs, it's super easy to assume it's going to be highly uncomfortable.
Well, you'll be so relieved to know that generally it is not painful. The vast majority of women tolerate the process remarkably well with only minimal discomfort. Yes, the medications are administered through injections, and that might cause a tiny little sting, but they use very thin needles. Because the whole 8 to 14-day process is so highly controlled and heavily monitored, your comfort really is prioritized.
Now, as your ovaries safely expand to hold those extra eggs, here are the expected sensations. You might feel some mild discomfort, a bit of bloating, or some pressure in your lower abdomen. Think about it. It's like your ovaries are doing a little bit of extra heavy lifting, physically expanding slightly to accommodate multiple follicles instead of just one. So that sense of fullness or pressure, it actually just means your body's responding beautifully to the protocol.
All right, Section 5. Improving your chances. The ultimate goal of your treatment.
So why go through those clinic visits and injections? Because COH significantly increases your chances of conception. It is incredibly successful at aiding women of advanced maternal age during IUI or IVF cycles. We all know that naturally, the chances of pregnancy decrease as we get older. But by utilizing this controlled stimulation protocol, doctors can actively enhance egg quality. It literally gives them the absolute best materials to work with, providing you with a profound evidence-based advantage.
Finally, Section 6. Care at ART Fertility. World-class support in the UAE.
The team guiding you matters just as much as the science itself. ART Fertility Clinics makes this journey really accessible and comforting across the UAE, with world-class facilities in Abu Dhabi's Marina Village, Al Ain, and 2 centers in Dubai, one in Suqaim and another in Dubai Healthcare City. This is a huge deal because those regular monitoring scans we talked about during your 2-week window can be done conveniently close to your home or work, which minimizes the disruption to your daily life.
Plus, you are in expert hands, guided by renowned specialists like Prof. Dr. Human Fatemi, consultant in reproductive health. Having internationally recognized leaders analyzing your baseline tests and scans means your hormonal changes aren't just being predicted, they're being carefully managed by some of the absolute best minds in reproductive medicine to ensure your safety and success.
So, are you ready to take the first guided step toward your fertility goals? Now that you know the timeline is just 8 to 14 days and the process is carefully controlled to keep you comfortable, what questions are you going to bring to your first consultation at ART Fertility Clinics to take back control of your journey? Armed with this knowledge of how it works and what to expect physically, you are no longer just a passive passenger. You are an informed advocate for your own future. Thank you so much for joining me on this explainer, and I truly hope this guide has brought you the clarity and confidence you absolutely deserve.